So our next presentation, we've got having an overview in midwifery in WA, and I'd like to introduce Tracy Martin. Okay, Tracy is our Principal Midwifery Advisor in the Chief Nursing and Midwifery Office, and she will then introduce our other speakers. So take it away, Tracy.
Can you hear me? That's better. So I am the Principal Midwifery Advisor at the Department of Health in the Clinical Excellence Division. And basically, I am the voice of midwives in government. So I am your representative. I am the representative for the midwifery profession. So just to give you a bit of an overview of midwifery in WA, we need to go back in time. So think back to when Moses was put in the cradle in the river. It was a midwife that actually saved him. So when the Pharaoh said, "You must kill this baby," the midwife saved him. Then we think about Christ, and there were 2 midwives at the birth of Christ. So we have a lot of influence. It is one of the oldest professions. However, midwifery is very political, and no more so than in a state like WA. So we think about maternity services in WA. 99% of women will give birth in a hospital. Think back 120 years ago, 99% of women gave birth at home. So we've changed a lot. So in the slides, they're just going to keep rolling, so I'm going to go a bit off script. So there were 3 influences in the midwifery profession. So there was the clergy, the church, and you may remember that not too far in our distant past, midwives were burnt at the stake as being witches, when they were actually wise women who helped women to birth. So the law, and of course medicine. So if we think about the models of care here in Western Australia, given that 99% of women birth in hospitals, it's a very medical model. Now, for those of you who have done your midwifery education, it's all around continuity of care. So this is around you holding that space and advocating for women to get continuity of midwifery care. So part of my role is to agitate the government to make these changes to promote midwifery as the primary carer for birthing women and their families and the communities. So how do I do that? Well, let me tell you about the regulation of midwifery in WA. So midwives became regulated in WA in 1926. We weren't the first state. Tasmania beat us to that. And midwives did a 6-month course. Excuse me. So they did a 6-month course. They didn't have to be nurses first, and they were classed as midwives, and they could care for women. And as I said, they were cared for in the home. So then we had medicine that came along and said, no, home's dirty, we can't have these women birthing at home, they need to come into hospital. So that was really the beginning of the end for the midwifery profession at that time. And medicine also had significant control over nursing. So the medical board brought nursing and midwifery under their umbrella. So that's what really drove the models of care in WA up until about the 1970s, when the UK actually introduced the first direct entry midwifery program in the world. So this was a release of the profession, not only from nursing, but also from medicine. So WA took a bit of a time to follow suit. Well, Australia, in fact, took a bit of a while to follow suit. And we now have pathways for midwives who don't want to be nurses. We have many pathways, so we have double degrees. So that's where we came to. So in WA in 2006, and some of you will remember Barack Obama, the law was changed to recognise midwives as a separate and distinct profession from nursing in the WA law. So that really was the beginning of the recognition of the profession. In 2010, national registration came into play. So this is our regulatory body, so the Australian Health Practitioner Regulatory Agency, the Nursing and Midwifery Board of Australia. So they are the body that regulate our practice and set our professional practice standards. So Nat's probably talked a bit about what you need to do to get registered, but in order to maintain your registration, there's a number of things that you need to do. And that is around ensuring that you maintain recency of practice and you complete continuing professional development. So for your recency of practice, you have to have practiced at least a certain number of hours in the past 5 years. For your CPD, you need to have completed 20 hours. If you're a nurse and a midwife, you need to do 20 hours in each profession. There will be some overlap, so you can count as both. And it's within your context of practice. So for me, I'm predominantly a policymaker. I provide advice to the minister. So my context of practice is, no, I'm not at the end of the bed anymore. I'm not in that clinical environment providing midwifery care to mothers and babies. So my context of practice is around that advice. So that's what you need to do. So for midwifery in WA, we've had a few reforms. So 2009, we had the National Maternity Reforms, which recognised the value of midwifery continuity of care for women. And there was a huge impetus in promoting midwifery continuity of care in midwifery group practice models. So in 2009, we had 0 midwifery group practice models. We had midwifery continuity of care, and that was through our family birth, the home birthing program, through the community midwifery program. And we had pseudo continuity of care through the family birth centre. I'm pleased to say that 11 years later, we now have 13 midwifery group practices where women are given the choice to have continuity of care with a known midwife. We've still got a bit of a ways to go until we reach critical mass. I think the important thing that we need to remember is that pregnancy and birth is not an illness. And if I can impart these things to you, then look, I've done a good job. It is a normal physiological event. As midwives, you hold the women's space. You advocate for women. You advocate for their choice. So don't be afraid to speak up. You are the future of the midwifery profession. And if anyone has a voice for women, it's you, as those midwives coming through the profession. The other thing is WA is a very diverse place. We have nationalities from all over the world, and we have our First Nations people. So another message that I want you to go away with is to treat everyone with dignity and respect. Everyone has their own story. You are meeting women and families at their most vulnerable time. Being at the birth of a new life is the most humbling experience in the world, and it is a privilege to be there. So respect, talk to, and earn the trust of those people that you're providing care for. Thank you.
Morning, everybody. My name's Jodie Atkinson. I am the Graduate Coordinator of the Women and Newborn Health Service Midwifery Program. Can I get a show of hands of how many of you in the room are midwives or going to be midwives? Okay, so there's a few of you, that's good. I'll just wait for my PowerPoint to come up. Excellent. Okay, so Women and Newborn Health Service is actually a group of women's-based health services all combined under that title. We're actually not a health service. We actually come under North Metro Health Service, but we're defined by that name. So we offer a 12-month graduate program for all midwifery graduates, and we also offer a 12-month graduate nurse program in perioperative care. King Edward. Was anyone born at King Edward? Yeah. We opened in 1916, 5 years ago. We celebrated our 100 years. You may have seen that in the media. And it's the largest maternity tertiary hospital in WA, and it is the referral centre for the most complex pregnancies in WA. Last year, the year of COVID, we birthed 6,300 babies, and I can tell you that it will be more this year. So we're a very, very busy centre. Our vision: excellence in healthcare for all women, infants and their families. Our mission: to improve, promote and protect the health and well-being of all women, infants and families. And our values are those of the North Metro Health Service, which is care, respect, innovation, teamwork and integrity. It's worth knowing those words when you do your selection criteria. So our program, we recruit twice a year. February and July, August are our intakes and recruitment periods. All graduates are employed at 0.8 FTE, so that is 8 8-hour shifts a fortnight. If you're on night duty, you do 10-hour shifts, so they do get adjusted slightly. Everybody applies through Grad Connect through the process that Nat just explained to all of you. All midwifery graduates complete these rotations: outpatient antenatal care wards, so that's inpatient antenatal and postnatal women with their babies, breastfeeding centre, labour and birth suite and maternal fetal assessment units. So every graduate does a rotation in those areas. In addition to that, every graduate gets 3 days full orientation to the hospital and then 4 paid study days in these areas, as well as 14 clinical workshops which are on various topics. And if you come to our booth outside, I've actually got a list of the current ones. Then every grad has the opportunity to attend other rotations as well. So some of these that you may actually get to participate in: our visiting midwifery service, our emergency centre, which cares for women under 20 weeks gestation, our mother and baby unit, which is our mental health unit, neonatal care unit. Neonates actually belong to the Child and Adolescent Health Service, but we still actually do get to put a grad in every rotation to the NICU at King Edward. And just recently you may have heard that Women and Newborn took over the governance of Osborne Park Hospital. So Osborne Park is a secondary maternity service and will actually now be one of our rotations through our graduate program. In addition, you can actually, once you're successful in the graduate program, apply for these rotations. So we offer a research internship. 1 graduate each intake will work 1 day a week with our research department. So that's our Professor of Midwifery, our Research Fellow, and the research assistants that work in that team. That is very, very valuable experience if you are interested in research, and it's a very competitive application process. We have currently 5 midwifery group practices at King Edward, and each one of those takes a grad for just about 7 months of the program. So again, very competitive. You have to put in an additional EOI, and they choose the 5 grads that they want to take in. These are both there's 3 in the Family Birth Centre and 2 hospital-based midwifery group practices. They work on a 24-hour on-call system, and again, very, very rewarding. And in my last 3 intakes, all the graduates that have been part of that program have actually remained working in that model of care. And just new, starting this year, we are working with the West Australian Country Health Service to offer a placement in a country hospital, a regional centre. Again, this is an additional process. The locations will change depending on what the need is in WACS for this program, but if you have an interest and would like to experience the country before you actually move there permanently, this would be well worth considering. And again, come and talk to me afterwards if you're interested in that. What sort of support do you get? So you've got me, I'm the coordinator of the program. In addition, I have a clinical facilitator that supports graduates in the clinical setting as needed. You have a 3-month and 11-month practice review where we sit down and I can assist you with your own professional development. We offer a mentorship program. Every graduate has a mentor available to them if they would like one. We have staff development midwives in all areas of the hospital. We have peer support. I get the grads together regularly for peer support sessions so you can actually support each other. And we have supernumerary time in all clinical areas. So it's not that you just have your orientation at the beginning, you get that in every clinical area. So the week you're in breastfeeding centre, that is all supernumerary. You get your first week in on the wards as supernumerary, labour and birth, etc. So you are well supported in that area. If you want any further information, I am here all day at the booth, or my details are here, and you can actually grab a flyer with those on as well. So, and that's our last lot of graduates that graduated from the program. Now, I'd like you to introduce my colleague, Nicola Ireland, who's going to tell you about our perioperative course.
Thanks, Jodie. Hi everyone, my name's Nicola and I'm a nurse educator at King Edward, but I'm also a perioperative nurse. And my passion is anything to do with theatre and recovery. So can you put your hand up if you've been to theatre during your nursing studies? Okay, that's good. So a few people would have been exposed to what life is like behind those big, scary theatre doors. So the aim of the program is an introduction to perioperative knowledge and skills. So they're the core perioperative principles that are going to hold you in good stead for a career in perioperative nursing, whether it be in the operating theatre, whether it be in a day surgery unit, or if you're more interested in acute care in the PACU unit as well. So you'll gain specialist experience within the areas of women's health, and it will promote the development of critical thinking skills in perioperative nursing. So this is a new program that we're just starting this year, and it's a 12 months where you'll get to experience all the specialties at King Eddie's Theatre as well as PACU. Oh. So the clinical perioperative rotations that you will expect to rotate through during your 12 months is obstetrics, where you'll see quite a few complex obstetric cases, including invasive placentas to the uterus, which are cases that can go on all day and can encompass a very wide variety of skill sets. Gynecology, where you'll see laparoscopic open procedures and gynae-oncology, where you'll see the specialist equipment and specialist knowledge involved in operating in the gynae-oncology setting. Urogynecology, preoperative assessment bay and some experience with the day surgery unit, as well as the post-anaesthetic care unit. So you'll rotate through all of these areas. So some of the perioperative seminars that you'll be involved with include surgical suture workshops, surgical hemostasis agents, surgical wounds, perioperative quality improvement, and this will be a good introduction also into research if that's something that you're interested in, surgical smoke plume and surgical diathermy safety, and then PACU related seminars including diabetes within the perioperative setting as well as adult sepsis. There's also a range of study days which the graduate will be able to attend, including a perioperative issues study day and anaesthetic simulation study day. In theatre, we like to, we're very hands-on, so as many simulations as possible during your time. You'll also be able to choose from a range of other study days, including cancer across the lifespan, blood management, pain management, and Urogyne study days as well. So this is a picture of our last lot of grads that came through theatres. So in terms of support, the graduates will be offered an extensive supernumerary orientation program with clinical support and mentors, a structured workbook with specific clinical skills and objectives to achieve across a 12-month period, ongoing education and resources available through an online learning platform, 5 paid study days across the 12-month period, and as I explained earlier, monthly seminars and workshops on topics relevant to perioperative nursing. All right.
Just one thing I do need to mention, there is another new program that we're commencing which will start with you guys next year, and that is specific for our dual degree qualified graduates. We are actually going to offer a women's health, as part of the midwifery program, a graduate program in basically women's health. So you'd spend some time on our Ward 6, which is our gynae early pregnancy ward, some time in our gynae clinics as well as our antenatal clinics, and then the midwifery component as well. So if you are at ECU doing the dual degree, I believe we are the only hospital who is actually offering this sort of graduate program. You apply for the normal midwifery program and then you tell us on our preference list that that is actually what you're interested in. Okay. And don't be fooled by that photo I put up of our recent grads. As Nat mentioned, every organisation is actually taking more graduates this year, so please don't think that if you apply with us that you won't be successful. You've got a very good chance of getting a place. Any questions? We can't actually see you very well, so maybe stand up if you want to ask a question. No? No? Okay, well, thank you. If you've got any questions that you think of, please come and see us at the booth. And yeah, best of luck, guys, with your last semester.